Hi, and welcome back to ByteMed, a podcast dedicated to helping you keep up to date with the fast evolving world of health AI and learning what is directly relevant to you. I'm Harish, your host and co-director with the Artificial Intelligence and Medical Systems Society. In today's episode, we're diving into the vital role of patient and caregiver voices in shaping healthcare. While AI and technology continue to revolutionize industry, real-world impacts happen with those most affected. Patient caregivers are actively involved in the decision-making. Now that's where the Patient Advisor Network, or PAN in short, comes in. PAN is a Canadian not-for-profit and a thriving community of practice where patient and caregiving patients, whether new or experienced, come together and drive meaningful change. Not only does PAN provide a space for collaboration, but also offers consulting services to healthcare organizations, ensuring that the expertise of those with lived experience informs system-wide improvements. So why is it essential for patients to be involved in networks like PAN, and what are the ways the Canadian healthcare system has already benefited from such a network model? Let's ask the experts themselves. We're thrilled to welcome Chris Johnston and Elise Maybee from the Patient Advisors Network, an organization that's dedicated to fostering collaboration between patients and caregivers to enhance and transform Canadian healthcare. It's a pleasure to have both of you in the podcast today. Could you maybe share a bit about your personal experiences in yourselves with PAN and how you became involved in the organization?
Okay, perhaps I'll jump in first. My name is Elise Maybee, and I co-founded PAN with 12 patient caregiver partners from across Canada in 2017 as a community of practice for patients and caregivers. But it's also a consulting practice where we offer services to healthcare organizations and teams based on the expertise of patients and caregivers. I've been a patient partner since 2011 and in all aspects of healthcare, including policy research, quality improvement, service delivery, you name it. Hey, Chris.
And I've been a member of PAN for about 2 years, and I've been a patient partner in research since about 2018. I'm originally Irish, but now live in BC. And I got involved initially in research as a research subject, and then quickly sort of moved into partnership because I was really drawn to how I could contribute as a patient to helping improve healthcare, which was how I came across PAN and the opportunity to get involved in various projects. And so I'm involved in things like health technology assessment, virtual care standards development, and a range of other things. Many of those opportunities I found through PAN.
That's amazing. Many think of patients as just recipients of care, but being a patient, being a partner means collaboration in the decision-making process. So how do patient partners contribute to shaping research questions, design, and outcomes? And why is this collaboration so important for advancing healthcare?
Well, I think the first thing to understand is that it's more than just patients. We use patients as a shorthand, but we're really talking about people with lived experience. So that can include caregivers and family members. And when we say lived experience, they may have lived experience of a particular condition, but they also may have experience of a particular service that a health authority offers, or a particular type of experience in healthcare. And so I think it's important to get the full picture of what kind of experience a patient can bring to a particular project. And when we say partner, what we're really saying is that they're a full team member. When you're looking to recruit somebody with lived experience, you're looking to bring them in right at the very beginning so they can help you shape the research question. And I think quite often what we're bringing is lenses around what's of priority to patients and communities. And we bring that understanding because we're at the kind of coalface of healthcare. We're where the rubber hits the road, if you will. We're the people that it impacts the most. But we also bring a whole range of life experience. So you'll find people who are tech savvy, you'll find people who are business savvy, people who are savvy in all different sectors of society, because that is the whole range of patients, is the entire society. So I think when you're looking to involve patients in a project, you kind of need to think, well, what kind of people do we need present? And then look in those sectors to find people who are patients, because you'll find some of us everywhere.
I think one thing I was going to ask you, because you did mention that you do some health tech assessment, and you also sort of mentioned that you have some patients and partners that are more tech savvy, let's say. How does that look on the PANS side? What sort of initiatives do you guys do when it relates to health tech assessment?
So I'll jump in on this one. First of all, we don't talk about it on our site as yet. We're in the process of updating it. But we've had, for example, PAN has had a contract for over 5 years with the Center for Digital Health Evaluation out of Women's College Hospital here in Toronto. And we have done now over 28 different projects with them evaluating various different technologies. It could be anything from virtual care to clinician dashboards. One of the more technical ones was the regional security operations, cybersecurity project that we did. And we have done one or two on AI Scribe, evaluating the AI Scribe, the use of it, and so on, and the impact for patients and caregivers on all of those. So that is, I guess, perhaps our longest standing set of contracts has been with that organization. But we also are working with CIHI, the Canadian Institutes for Health Information, and we've worked with CIHR, the Canadian Institutes for Health Research as well. Don't want to get lost in the acronyms. Yeah.
Perfect. Thank you so much. And I guess you did mention AI in there and AI scribes more specifically. I'm a little bit more interested in that side of things because we do actually do AI scribe projects through the AI Medical Systems Society ourselves. So I guess for people like us that are trying to do some of these projects or people who are developing these AI scribes, from the sorts of involvements you've had in these projects, what are some of your tips and tricks for people who are trying to start a project like that? It doesn't necessarily have to be AI scribes, generally AI in healthcare algorithms and projects. What are some things that researchers and clinicians and people who are developing these sorts of algorithms have to have in mind?
If you're talking about involving patients and caregivers as partners on the research team, you just want somebody who's not terrified of AI, who would be interested, because it's these things are going to infect us either directly or indirectly, and we need to be involved and understand the decisions and the scope of things. Healthcare is changing so rapidly, not only from AI, but the whole digital world is impacting healthcare and the delivery of healthcare, and it's being accelerated because of the introduction of AI. And we have to be at the table because otherwise people will make decisions about us for us, and they may not be the decisions that really are the kinds of things we want to see.
I think something also to be aware of is that when you're talking about patients, don't assume that they're not particularly savvy, because, I mean, I've worked alongside nurses who were particularly phobic about using different types of technology. I think that's a kind of strand that runs through every sector. You'll have people who are more inclined and people who are less inclined, people who are early adopters and late adopters. I think what you need to look for are people who are willing to explore and who are curious, and you'll find a lot of those among the patient partner community. I think don't be afraid to introduce terminology. Don't be afraid that we'll ask questions. We will ask questions. Questions are a good thing because questions can actually open up the room. I've been involved in groups where doctors are afraid to show their vulnerability by asking questions that they don't want to be seen as being unknowledgeable, but we open up the room by asking questions that other people are perhaps afraid to broach or afraid to allow people to know that they don't understand. I think that's a really good quality that we bring, is that we're not afraid to ask questions. But also we will take on board some of the broader scope of the project, but we'll also open horizons. We'll actually bring to the table concerns that we may have or concerns that we've heard in our community, and you can help us disseminate information about what not to be afraid of, what not to be concerned about. So I think that's a really good two-way communication process. Patients in particular, we come with such a breadth of expertise that we can actually find ways to recruit patients as subjects for your projects. So if you're struggling to find people who are willing to participate, we actually have inroads into communities and into particular sections that you may not even be aware of, where we can say these are people that you could approach, these are places that you could advertise for participants. This is the kind of community knowledge that we bring to the table. So there's lots of benefits to involving patient partners.
I think Chris raised an interesting point also, because in effect, the patient caregiver community, partner community, is a proxy for the public. We are the segment of the public that are really deeply interested in healthcare and healthcare transformation. But we, talk to two people who talk to two people. So it can be a conduit for a larger conversation that is necessary in the public about AI and healthcare.
Yeah, it seems like there's been many examples that that you've been working with, a lot of different initiatives that Pan has worked with. Could you maybe share a story of where an involvement of patient partners had a positive effect on the outcome of a research project or an initiative? A specific example?
Yeah, I can, as a matter of fact. One that comes to mind is a project where it was during COVID and we were doing something on the effect of using virtual care across the different care sectors. And because we were doing it rapidly, there was an issue with just looking at urban um, hospitals. And it was us who raised the fact that this was um, not a wide enough scope. And while the scope, because of the timeframes, couldn't be enlarged at that point, it was looked at later to go into the rural and remote communities to find out more information. So we're sort of aware of some of these things. And when I think about another one where we were looking at the clinical dashboard, for instance, it was for doctors. So what would patients have to say about it? But the patient partners on that suggested that it be designed in such a way that you could eventually flip a switch and make some of this available to patient partners as well. I'm a former technologist. I know if you design from the start those things, then it's sort of nothing to be able to do those flippings of the switch. But if you don't, then it becomes either impossible or just too costly to do it. So those kinds of things are some of the things that we can bring to the table.
I think sort of related to that, this just brought up another thing in terms of AI scribes, for example, that we had talked about before within our team as well. And one of the things we've talked about is, yes, AI scribes can help physicians in terms of the paperwork and administrative work that they have to do, and it can automate some of that process. But how does that look like exactly for patients? Do the physicians actually spend more face-to-face time with their patients? Do they spend more time trying to actually listen rather than type? And so some of these things actually goes into that AI scribe as well. I don't know if you have any more to add in that sense, and how to make sure the patients are involved in those sorts of processes as well. Even in terms of surveys that we do of people who are using the technology, but who is the end user in these cases?
Right. So the role of a patient partner is not to answer those surveys, but to help design those surveys so you get the right kinds of answers from the participants. Because the role of a participant is very different than the role of a patient partner. We're on the research team and we can help source participants. We can certainly, in many, many cases, get very heavily involved in the crafting of interview questions, survey questions, and so on. The other role that we play is that we can also target the right kinds of people that should be participants, that should be surveyed, because often one goes to the people that you know, the people you're comfortable with, and you forget the equity groups that really need to be considered. People who don't speak English or French as a first language, people who maybe are not digitally literate or have no means of using digital tools. And so one of the things that we very carefully scrutinize for is, what are the alternatives if the digital isn't going to play for certain people? There needs to always be an alternative so that people are not left out, which is very often the case in our systems. So we bring that kind of thinking to the table as well.
The other thing, again, is around understanding that the lens is very much focused on the patient experience. So health technology assessment, one of the things that we reviewed was an AI scribe project, a very early one. And most of what was presented by the vendor and the team that they had assembled was around what it could do for the healthcare system and what it could do for the doctor, the physician in the room. And one of the things that they had missed was providing any direct benefit to the patient. And the two patient partners on the panel, we actually went away and thought about it and came back and said, well, have you thought about the fact that it could provide a synopsis of the discussion with the care plan to the patient directly? And at that stage, they hadn't scoped that out. But that became part of the project that they were looking at going forward, which wouldn't have been added at that stage. It might have been added later, but it would have been very much an add-on later on, whereas they actually got it in right at the beginning of their development process. And I think not having the patient in the room means that you miss out on those opportunities to include direct benefit.
These are actually amazing examples. I love that this has happened before, and that things have actually changed and got adapted early on for these things. One other thing I wanted to ask is, for example, one of the things we're doing as researchers is running some of these events, like let's say a rare disease day event that's I'm actually involved with. And one of the things we've thought about is potentially involving patient partners throughout these I guess research events that still, like, we still have the patient side of things and we have the patient angle in the discussions. So I'm sort of trying to broaden that question now to both of you. What are some other ways that patient partners could be involved in research projects, in trying to improve the quality of healthcare? I guess even thinking about from like fundamental science to translational research to like very much clinical health informatics research that we've been talking about. What are some other ways you think patient partners could be involved and researchers should think about involving them?
Well, one of the projects that I've been involved in recently is actually with a team, and they're a uterine health team, and they're looking very much to get into AI. And they were struggling to find roles for patient partners. And one of the kind of open group discussions we had with about 6 patient partners and about a dozen members of their team, we actually brainstormed around what we could actually do to assist. And what came out of that was that as 3 members of the patient team were very interested in reading research, we actually took on some of the burden of reading some of the literature research that they had done. And as some of the members of the team were more interested in researching themselves on what kind of AI products were already available in that particular discipline, some of those people took on to bring back ideas of what they were seeing out on the web. So they went out and they searched for AI products that were already targeting uterine health. And I think that kind of innovation and being willing to kind of brainstorm and allow patient partners to find their own roles within the team, I think is really useful, because again, it kind of opens up what you're capable of and what your scope can include in terms of your project.
Yeah, I'll just piggyback a little on that, because I think also patient partners are often more plugged into other forms of communication. And I have found over my years in research that researchers tend to think solely about academic papers published in journals or presentations given to the in crowd, if you will. And that is a form of knowledge translation, but it doesn't bleed out into the wider community. And there is a great deal of research that should be something that comes into the public sphere. And so then we're talking about more of a communications rather than academic knowledge translation. And patient partners can often come up with really great suggestions and guidelines about how to do that, as well as that they can also help in the formal presentations and in the writing of the journal articles as well.
So Pan's ability to connect researchers with patients and caregivers is key. So how do researchers and these projects navigate the network in a meaningful way? So what steps would you recommend to get started for someone hearing about Pan and their resources for the first time?
So there's 2 main ways that researchers and other people in healthcare can collaborate with us. The first way, which is very simple, is that we have what amounts to a job board, if you will. We call it opportunity posting. So on our main page, there is a form that any researcher or anybody with a project can fill in, and it gets posted to our internal community job board or opportunity board, and anyone in the community can then respond to it. We don't, as an organization, proactively try and match people, but we give people the opportunity to see what's out there. And so that's one way that can be done. But the second way is, and we have also collaborated as an organization with two research teams more recently, one with Julia Abelson out of McMaster to do the Canadian Patient Partner Survey. And we were able to reach well over 500 of our colleagues who do this work so that she could develop with us together a profile of who we are that do it. So that was one. But then the other one we did with the Center for Patient Public Partner Engagement, CEPPP, out of the Université de Montréal. They were looking to develop a framework for patient partner engagement in research. And so we collaborated very closely with them to produce what turned out to be called the Learning Together framework for patient engagement evaluation or patient engagement and research evaluation. So we've done both. So we collaborate with research teams, but we also collaborate with organizations. And it depends on the nature of the research. We've put forward, I can't tell you how many of joint proposals with researchers, but we all know that the rate of acceptance is not particularly high. So it's always a bit disappointing. I just learned of a rejection today, which is very disappointing. But it happens, and we try our best to make those grant proposals as robust as possible from our perspective so that they have a good chance of success if we're going to engage with them. Yeah.
So I guess this sort of goes into a question I was going to ask both of you. I know patient-oriented research is something that's sort of a phrase that's been thrown around recently a lot. And I have seen my fair share of proposals that talk about patient-oriented research, yet it doesn't seem like there's been a lot of consultation with patients or patient partners. And it's mostly the researchers thinking the sort of the impacts that it might have for patients. I guess you sort of talked about collaborating with researchers on even the proposals ahead of time. What other aspects or I guess strategies could you recommend for researchers to make sure that their research is actually patient-oriented?
Well, I think one of the big challenges, if I can just jump in, and Chris, you can add later, but one of the big challenges I know is, especially for early stage researchers, the brainstorming of their ideas is not something that is funded. So it's very difficult for them to find patient partners, to develop relationships enough to sit down over a cup of coffee with a couple of patient partners and run the idea of their research by them. One thing we are trying to do as PAN is provide opportunities for this to happen so that they can be assured that the research they're doing is going to hit the mark for the people who are going to be the recipients of change as a result of their research. And last year we hosted a hub at the Casper conference, the big health research conference in Ottawa. And we scheduled various researchers to have one-on-ones with those of us who are experienced patient partners and research so that they could do just exactly that. So there are different ways that we are sort of trying to brainstorm and bring that opportunity to the research world that is missing and not really supported in the way that it could be.
And I think it's true that there are a lot of projects that are trying to achieve patient orientation without necessarily direct involvement of patients, which can be quite difficult. And even without funding, I think there's a possibility to look for patients to start to discuss what the options are that are open to you. I mean, for example, we haven't seen this yet, but I would highly encourage it, that if you're thinking about a research question and you haven't fully formulated it yet, you could come to PAN and post an opportunity for a focus group where you invite half a dozen patient partners to discuss with you and help formulate the question. And maybe from that, then, when you get your funding, you can come back and ask some of those patient partners to be an ongoing part of your project, because that way they're already warm to your question, you're already warm to the people that you've met, and it gives you the opportunity to build rapport going forward. I think we'd like to see more of that. We'd like to see more opportunities for interaction between patient partners and researchers, even before the projects have gotten off the ground, because there are lots of ways that you can recruit participants, but finding people that you're comfortable partnering with when you've never really broached that before, it can be quite difficult. But I think we're open to finding new ways to make those connections.
That's amazing. I think that you sort of, I guess, answered my next question that came up while you guys were talking, but I'll still ask it if you wanted to add anything. I know some of our audience might be student researchers who are sort of new to the research area. They might not have done any sort of literature review even, and they're in the or beginning processes or very early processes of, I guess, trying to formulate a question. And they want to make sure that this is something that's impactful and it's actually going to like hit the mark, as you were mentioning before, in terms of making sure that it is patient oriented and they actually involve all the stakeholders in there. So do you have any extra, I guess, tips for specifically students in terms of how they can maybe even involve PAN or overall involve patient partners and make sure that their project is very much patient oriented?
Wow. So yeah, that is the challenge, and that was the reason why we approached Casper to co-sponsor the hub, so that people could come and talk to us within that context. But I think, to Chris's point, there's no reason why we couldn't brainstorm with other groups that are trying to do something to support early stage researchers as well. There may be other things that we can do, and we would be open to that, just as we were open to Casper asking us to do this. Well, actually, we went to them, but they were open to us, let's put it that way, which was really wonderful. And it turned out to be a win-win all around.
And I think that's one of the reasons why we were also interested in AIMS, is because you are close to student and early career researchers. And we're very interested in getting to meet people early in their career, so that it becomes a normal way of business for them to involve patient partners. Because I think there's huge opportunities going forward. And of course, the SPORE initiative nationwide is very keen to get people involved in patient-oriented research. And I think collaboratively we can build those relationships and work more stronger together, if you will. But I think there's also opportunities to tap into additional funding that may not necessarily arise if you're not thinking in terms of patient partnership. Because, for example, SPORE have whole rafts of funding that they offer to SPORE-funded entities, and there's ways to tap into that if you're willing to actually kind of reach out and get patient partners on board. And that's something else that could be added for AIMS researchers in particular.
Perfect. Yeah. No, thank you so much for your time today. This is definitely very inspiring, the resources that are available for people who are very early, maybe in their project proposals, and trying to find the necessary resources and the relationships they're looking for. It's clear that fostering these relationships is key to advancing not just only research, but the quality of healthcare we all receive. So thank you so much, Chris and Elise.
Thank you.
Our pleasure. It's great talking with you.
Thank you so much.
Yeah.